Welcome to Module 1, Overview of Washington Apple Health Medicaid. We will cover the following topics: Washington Apple Health Medicaid Overview, Classic Medical Programs, MAGI-based Medical Programs, MAGI-based Application Process, Administrative Hearings, Change of Circumstances, Retroactive Apple Health, Authorized Representatives, and Resources. Washington Apple Health Medicaid Overview. Healthcare Authority, HCA, is the single state agency for the policy and purchasing of all Apple Health programs in Washington state. For the purposes of eligibility, Apple Health is divided into classic medical programs and MAGI-based medical programs. MAGI stands for Modified Adjusted Gross Income. This is the methodology that income is counted to determine eligibility. Classic medical programs. HCA contracts with its partner agency, the Department of Social and Health Services, DSHS, to administer some Apple Health programs for individuals who are aged, blind, and disabled. These programs are referred to as classic medical programs. Individuals applying for classic medical programs submit applications through the Washington Connection website. MAGI-based medical programs. Most individuals eligible for Apple Health apply for coverage through the Washington Health Plan Finder website. HCA works closely with the Washington Health Benefit Exchange as both entities share a single streamlined application for healthcare coverage through the Washington Health Plan Finder web portal. These Apple Health programs are referred to as MAGI-based medical programs. This training offered by HCA is geared to prepare community partners to assist individuals to apply for Apple Health coverage for MAGI-based medical programs through Washington Health Plan Finder. Community partners who are affiliated with a community-based organization in Washington State can complete this training and gain volunteer access to the Washington Health Plan Finder website. Once this training has been completed, the community partner can contact HCA Volunteer Assister at hca.wa.gov. A knowledge test is required, and once this is completed, an application for system access can be submitted. This application includes a registration form, Washington State Patrol background check, and Health Benefit Exchange user agreement. Classic medical programs. Staff at DSHS determine eligibility for Apple Health programs for individuals who are aged, blind, and disabled and long-term care. Applications for these programs can be submitted online at washingtonconnection.org, by mail or fax using a paper application, or in person by visiting your local community services office, or by calling 1-877-501-2233. Eligibility criteria varies for each program and is based on household size, income, and resources. Coverage groups that are administered by the Community Services Division of DSHS include aged, blind, and disabled ABD programs such as medical care services for ABD recipients, medical care services for HEN referral recipients, SSI categorically needy, SSI related categorically needy, qualified Medicare beneficiary, specific low-income Medicare beneficiary, qualifying individual, alien medical program, medically needy SSI related with no spend down, medically needy SSI related with spend down. Coverage groups that are administered by Aging and Long-Term Support Administration at DSHS include SSI-related client in an alternative living facility, SSI-related client in an alternative living facility MN, child parent LTC recipient, child parent AEM LTC recipient, child parent LTC recipient MN, SSI LTC recipient, SSI-related LTC recipient, state-funded LTC for non-citizens, SSI 1915C waiver recipient, SSI-related 1915C waiver recipient, state-funded LTC for non-citizens home, SSI Hospice PACE recipient, SSI Related Hospice PACE recipient, SSI Roads to Community Living, SSI Related Roads to Community Living, SSI Community First Choice recipient, SSI Related Community First Choice, Tailored Supports for Older Adults. MAGI-based medical programs. Most individuals applying for Apple Health coverage apply for MAGI-based medical programs. Applications for these programs can be submitted online at www.wahealthplanfinder.org, over the phone at 1-855-923-4633, using the mobile application WAPlan Finder, by fax at 1-855-867-4467, or by mail at P.O. Box 946, Olympia, Washington 98507. Eligibility criteria varies for each program and is based on household size and income, not resources. MAGI-based medical programs administered by HCA through Washington Health Plan Finder portal include Washington Apple Health for Parent Caretaker Relative, Medical Health Care Extension for Parent Caretaker Relative, Washington Apple Health Pregnancy, Washington Apple Health for Adults, Washington Apple Health for Kids, Washington Apple Health for Kids with Premiums, or CHIP, Washington Apple Health Alien Emergency Medical, and Washington Apple Health for Newborns. Some specialized medical programs administered by HCA include foster care adoption support, former foster care, breast and cervical cancer treatment program, refugee medical assistance, confidential teen pregnancy, family planning, and take charge. MAGI-based application process. Eligibility for MAGI-based programs is determined by client attestation with post-eligibility review. Eligibility criteria are cross-matched with state and federal data sources. Items that are unverified or income that is found non-compatible will be manually verified by HCA eligibility staff. Individuals who are found eligible for Apple Health are typically certified for a 1-year period unless they are found ineligible during a post-eligibility review, turning 19 years old, eligible for Washington Apple Health for adults and turning 65 years old, or starting to receive Medicare, determined eligible for a classic medical program, no longer a Washington state resident, or no longer meeting the specific eligibility criteria for the program they were approved on. Administrative hearings. All individuals have the right to appeal the decision the agency makes regarding their Apple Health coverage. An appeal has to be made within 90 days of a decision. Coverage may be able to continue during the hearing process. If the individual has an urgent health care need, they can submit an expedited hearing request. This administrative hearings attachment is included on all notices where a client may receive an adverse action on their coverage. Change of circumstances. Individuals approved for MAGI-based Apple Health are required to report the following changes within 30 days. Residential or mailing address, marital status, family members or dependents moving in or out of the residence, tax filing status, pregnancy, health insurance coverage, immigration or citizenship status, income of more than $150 that is expected to last longer than 60 days. When an individual's coverage is changing or ending, the agency gives them at least 10 days notice. Exceptions to the 10-day notice period include, but are not limited to, the action was requested, returned mail with no forwarding address or current address on file, or death. For more information, see WAC 182-518-0025. Notices are sent when the agency approves, denies, or reconsiders an application for Apple Health, renews Apple Health coverage, requests more information, changes or terminates Apple Health coverage even if an individual is approved for another program. Each notice sent to an individual may include, as required, the nature of the action, the effective date of this action, the facts and reasons for the action, the specific regulation on which the action is based, appeal rights, right to continued coverage. If notice requirements are not met, coverage will be reinstated back to the date of the action. However, once notice requirements are met, action may be taken. Coverage for deceased individuals. When applying for MAGI-based Apple Health coverage, applications can be submitted on behalf of a deceased individual who has passed away up to 3 months prior to the month of application. Only certain individuals are authorized to submit applications for Apple Health on behalf of deceased individuals. The following individuals are authorized to submit an application on behalf of a deceased applicant: a legal guardian or representative of the applicant or estate that extends past death, a surviving spouse, a parent of the applicant, or an adult child applying for their parent and no surviving spouse exists. For complete instructions on submitting an application, visit the link shown here. Navigators, certified application counselors, HCA community partners, and hospital financial counselors are not authorized to submit applications for deceased individuals unless they have been appointed as a legal guardian or representative that extends past death. The designation as an authorized representative ends upon the individual's death. Instructions for MAGI-based medical. Complete a paper application for healthcare coverage 18-001 and include: the applicant is deceased, the date of death, all household income received in the month of the death, including by the deceased applicant, verification of legal guardian or representative that extends past death if applicable. If retroactive eligibility is needed, fill out the retroactive health care coverage request form HCA 13-952. Include all household income received in the months prior to death, including by the deceased applicant. To submit a classic Apple Health application on behalf of a deceased individual, contact DSHS. The paper application for long-term care, aged, blind, disabled coverage, HCA 18-005, or an online application through Washington Connection must be completed. Apple Health Pregnancy Medical is a program that provides coverage to all pregnant individuals with countable income at or below the Apple Health standard. A pregnant individual's household size includes the number of unborn children and the number of household members. For example, a woman that is living alone and is pregnant with twins has a household size of 3, herself and her 2 unborn children. Once enrolled in Apple Health Pregnancy Medical, individuals will remain enrolled regardless of any change in income, exception is PER or residency, be covered for 60 days after the pregnancy end date, this is called postpartum coverage, receive 10 months of family planning only coverage after the pregnancy ends regardless of how it ends. This coverage includes all forms of birth control, permanent methods to stop having children, and health checkups related to receiving birth control. This coverage is automatic. For individuals under age 19, pregnancy-related services may be kept confidential. To apply for confidential services, individuals may apply for coverage through a paper application process or call the Within Reach Family Health Hotline at 1-800-322-2588. Applications for confidential services are not processed through Washington Health Plan Finder. A paper application must be submitted for pregnant teen health care coverage. For confidential services, individuals must answer the yes to the question highlighted in this slide. Individuals that are over the income standard for Apple Health Pregnancy Medical may be eligible for medically needy MN spend down. Individuals who qualify and enroll in Apple Health for medically needy pregnant women become eligible for MN coverage after incurring medical costs equal to the amount of the household income that is above the 193% FPL standard. For more information, please visit the link in this slide. Individuals who apply for Apple Health Pregnancy Medical after the baby's birth are not eligible to receive postpartum coverage. They may qualify for help paying costs related to the baby's birth if the application is submitted within 3 months after the month in which the child was born. They are eligible for family planning services. Retroactive Apple Health. Retroactive Apple Health is available for the 3 months prior to the month of application. For an individual who applies March 2nd, 2019, the retroactive months would be February 2019, January 2019, and December 2018. Eligibility for retroactive healthcare coverage is determined separately from an individual's current certification period. This may mean an individual is eligible only during the retroactive period. There are 2 exceptions for individuals who are ineligible at the time of application but are requesting retroactive Apple Health. These exceptions are for Apple Health Pregnancy Medical and Apple Health for Kids. When a child or pregnant individual is eligible in one of the 3 months prior to the application month, the following will occur. Children will receive coverage for 12 months from the month of eligibility. Pregnant individuals will receive coverage from the month of eligibility through the 60 days postpartum period. The request for retro must be made within the certification period following the retroactive period or before the determination of benefits and any appeal process is final. Retroactive coverage is not automatic. Individuals must meet all eligibility requirements for the months requested. The retro request is approved when the individual requested retro during the time specified above would have been eligible for Apple Health for any or all of 3 months if they had applied during that period and received medical services in the months requested. Let's take a look at a couple of scenarios for retroactive Apple Health. Scenario 1. Sarah is approved for Apple Health on September 1st, 2019, and she received medical services in June, July, and August. She submits her completed retro form 13-952 in December 2019 and attests to income of $1,700 in June, $1,550 in July, and $900 in August. The outcome: Sarah is over income for retro coverage for June and July and is approved for August. Scenario 2. Jean is pregnant and applies for Apple Health in April, but her countable income exceeds the standard. At the time of application, she also requests retroactive coverage for a month she received medical services due to her pregnancy. Her retroactive form reports countable income in February that was below the standard. The outcome: since she was pregnant in February, one of the retroactive months, she is eligible from February 1st through the entire pregnancy and the postpartum extension. HCA has a process in place to retroactively approve an individual for Washington Apple Health. Applicants, hospitals, and medical facilities are required to send their retroactive health care coverage request form 13-952 for MAGI-based medical retroactive coverage. Information needed for processing a request for retroactive healthcare coverage includes the total household income received in the retroactive months, the names of the household members requesting retroactive healthcare coverage, and the primary applicant's information. The form can be found on HCA's form website. Return the completed form to HCA by email at apple@hca.wa.gov, fax at 866-841-2267, or by mail to MEDS, P.O. Box 45531, Olympia, Washington 98504-5531. Retroactive Classic Medicaid. Requests for Classic Medicaid, aged, blind, and disabled are processed by the Department of Social and Health Services. For Classic Medicaid retro requests, the Retroactive Health Care Coverage Request Form 13-952 is not applicable. Authorized Representative, or AREP. An authorized representative, or AREP, is a person or organization that is authorized by an applicant or recipient to act on their behalf for Apple Health eligibility purposes. The AREP must be an adult and someone outside the medical assistance unit. See WAC 182-503-0130. An AREP may sign an application on an applicant's behalf, complete and submit a renewal form, receive copies of the notices and communications from the agency, act on behalf of the applicant in all eligibility matters with the agency. An AREP must have a good faith belief that the information they provide the agency is correct, act responsibly in assisting with an application, renewal of eligibility, or other ongoing communications with the agency, report changes in circumstance as required under WAC 182-504-0105, and maintain confidentiality. An AREP can share any information relevant to eligibility. However, the agency can only share information with the AREP that is necessary for the purposes of determining financial eligibility. Examples of information the agency cannot share are Social Security numbers, or SSN, birth dates, home or mailing addresses, places of employment that are outside of a request for specific employment verification, and estimated due dates. An individual can appoint an AREP using one of the following forms. AREP Form 14-532, which is shared by DSHS and HCA. Application for health coverage for MAGI, Apple Health, and QHP paper Form HCA-18-001. Confidential teen pregnancy application, paper Form HCA 14-430, or application for long-term care, aged, blind, and disabled coverage, paper Form HCA 18-005. An AREP can also be appointed online through Washington Health Plan Finder at the time of application, renewal, or change reporting. When an AREP is an organization, individuals of that organization may also act as AREPs. If an AREP is a division or other part of a larger organization, only individuals in that division or part may act as AREPs. For example, King County Public Health is a large organization. If the Access and Outreach Department of King County Public Health is designated an AREP, only those individuals in that department may act as AREPs. Individuals from other departments in King County Public Health are not AREPs. An AREP can be a court-appointed legal guardian with authority to make financial decisions on a person's behalf, or a power of attorney, POA, that grants decision-making authority regarding the person's financial interaction with the agency. A separate AREP designation is not required for a court-appointed legal guardian or POA. However, verification must be provided to the agency. The AREP designation may be terminated at any time by either the applicant or AREP, verbally or in writing. When the applicant or beneficiary is deceased, the AREP designation terminates, except when the AREP is the executor or administrator of the deceased's estate, legally authorized by the courts or by state law to act on behalf of the deceased or their estate, legal guardianship and POA assigned while the client is living ends after the client is deceased. An AREP can be designated by an individual on the application for health care coverage. Another option is the Authorized Representative Form 14-532. Resources. For more resources and training materials regarding Apple Health Medicaid, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications. These representatives serve specific counties. For more information about the Washington Volunteer Sister Program, please contact us via email at hca.volunteerassistor@hca.wa.gov. Congratulations! You have completed Module 1 of the HCA Community-Based Training. Please continue on to Module 2 of the 7-module HCA Community-Based Training. Thank you.